Well, welcome to the podcast with me, your host, Dr. Deborah Durst, and I have Dr. George Ibrahim with me today from Biltmore Restorative in Asheville. Say hello.
Hello, Dr. Durst. Always a pleasure being on here with you.
Well, I feel the same way, and I'm so glad that we're doing another topic together. And this is like, so when I have questions from a urologic standpoint, I'm texting Dr. Ibrahim to get answers. And recently, and sometimes, we'll try various things we've already talked about. And this one was, again, the topic today, retrograde ejaculation. So let's talk about why that happens with men.
I'm going to, define it basically. This is when a man ejaculates, but instead of, the product coming out, it goes back into the bladder. As far as the man is concerned, if his eyes were closed, he'd have no idea. It's the exact same feeling. It just doesn't come out the end that they're most used to it coming out. It goes back into the bladder. So it's a full orgasm. It's a full ejaculation, or sometimes it's a partial ejaculation. Some might come out, some might go back, but that's all it is. It's going back into the bladder because the prostate and where it empties into the urethra and where the bladder empties into the urethra are all within millimeters of one another. And it just happens. And I can explain why as you go on.
So, isn't the man talking about a decreased ejaculate volume and decreased orgasmic strength? We're talking about a man that's feeling the same sensation, less ejaculate.
So it's it's less of the volume of the ejaculate. As far as the strength, that has nothing to do with it being retrograde or being antegrade. Antegrade meaning being out towards the normal end. So if they have a decrease in the feeling of orgasm, that's a different topic. The decrease in volume or no volume is retrograde.
Okay. Well, because we frequently, again, have you ever used Pygium or heard? We did a podcast on it because one of our patients came in talking about Pygium, which is like this African tree bark that can be used as a natural supplement to like increase prostate health and increase ejaculate volume. So we did a podcast on it, but it's again a natural supplement, and men commenting about how much better their orgasm was with ejaculate volume. But we're talking about men that were noticing a decrease in, orgasmic strength. With this, you're talking about a man with no change in how he feels from the orgasm, but a decreased volume if he could actually see it. So, really, I think you saying if his eyes were closed, he wouldn't know is key.
But no,
It might be the question to
and
ask, actually, to see.
yeah, no, because they're different phenomenons and phenomenals, and to keep everything towards the retrograde ejaculation topic, I'll just steer things that way. I mean, what causes it? Usually, it's a medication or a prostate enlargement, or maybe if there's rectile stimulation from either a finger or toy or whatever, that can sometimes cause the prostate to swell, which will put some pressure on the urethra and the area that then forces it back into the bladder.
Gotcha.
But medications, different medications, typically medications that are related to blood pressure and or prostate flow tend to be the biggest contributors to retrograde ejaculation. Is it a pathological, by pathological meaning, is it a problem to fix? The answer is no. Like it's much better for somebody to control their blood pressure than to worry about retrograde ejaculation. The honest answer is it's hardly ever in my practice an issue that's brought up by the man.
Hmm.
It's the partner that brings it up. And whether she's a patient or with him or whomever, they get worried that something's going on. but it's nothing to worry about medically. In other words, as a urologist, if I get that consult, retrograde ejaculation, my response to the consult is no consult, not needed, not pathologic. It happens. Should happen.
So it's funny. So do you feel like when you were doing straight up urology practice that you talked about sex as much as you do now in your practice?
No, no, because and this is big, and this is no diss to the current urologist, but we're surgeons. Urologists are surgeons, and you got paid for the time you spent in the operating room, not talking about things. Whereas the type of practice that you and I have, we are there to talk to the patient. We're not dictated by insurance. We spend way more time and we can get, involved in these kind of topics. But, the other providers, that their time is limited. The
Yes.
typical insurance coverage is 6 minutes. Is that right?
No.
For a visit,
Yeah,
you
correct.
know,
No, it's not enough.
insurance.
Yeah. Well, and then you're talking about treatments dictated by insurance too, which is why regenerative probably won't be studied hugely. It is being
Right.
studied by, the groups that we're a part of, but it isn't going to be studied like drug companies supported studies. And if you look at those studies, they are all definitely, tweaked to represent, who's involved in the study. But again, meds and surgery, being the only things that insurance will cover. So again, your visit and what you offer is dictated by an insurance company. So I didn't think so. We've never talked about that before, but I had a feeling that there was nowhere because, no traditional docs really spend much time talking about because we didn't learn it in
No.
traditional medicine.
And as a urologist, I'm sad to say, I mean, I didn't talk about a lot of things because I had to get back into the OR. I mean, that's just not what we did. But if you have a guy that's got retrograde ejaculation, the first thing is there's no problem. There's nothing medically wrong. Did you start a new drug? Yeah, I just started this new blood pressure drug. Well, you might want to tell your doc if you're worried about the retrograde ejaculation. I mean, why are they worried? I mean, unless they want to produce an ejaculate, but everything else is the exact same. They've produced the ejaculate, it just went back into the bladder. They have felt the stuff that you feel from the orgasm. They just haven't, produced something that can make a mess. And it's up to them. I mean, and they want to change their med so they can do that. That's between them and the primary care provider, or certain urology drugs will do the same thing.
That's why I was asking because when we talk in both of our practice, just so you know, like again, Dr. Ibrahim and myself talk a lot about sex, like our whole office does. And so again, when you talk about the partner bringing it up, I also feel that with this in testicular size, you know, it's like, is it you that it bothers or is it the partner? It's always the next question, right? Because no matter who's bringing it up, I do feel like sometimes that masculinity is tied to testicular size. I say this jokingly, or maybe ejaculate volume. So it's like, does it bother you or the partner? Because I always say with testicular size, if it bothers you, great. We need to treat it. We need to, change that. But if it doesn't, trust me, if it's only bothering you because you think it's bothering her, she doesn't care. And it's because
That's
I've
right.
never heard a woman say that the testicles had to be larger and that they cared. Had nothing to do with,
Yeah.
and again, we talk about sex a lot, but women in general are pretty detailed about sex when they talk about it. I've never had a woman once say, I wish the testicles were larger. So we have different conversations than most, offices and practices. And so I feel like with that volume, you're right. Partner or you? Because if you're still
Yeah.
feeling it doesn't bother you, sometimes it's actually better for women, right?
If his eyes were closed, he'd have no idea.
And some women would be absolutely fine with that. Others might be bothered, But again, those are
Yeah.
conversations that we have in the office. So it's fun. But I think
It
that,
makes going to work fun.
yeah, it makes, yeah, and it's never a boring day, is it? There's always good
No.
conversation. But I think so. If it's meds, then address it. If it's not pathologic otherwise, and if it's an orgasmic strength, then I think, that Pygium was a great, I mean, we've had such positive feedback on that video, and we'll link it in the description. But it actually is supposed to shrink the prostate and then increase your ejaculate volume. And man after man have comment, like the jury's in that it works.
Okay.
So it's interesting. And we actually don't sell it in the office because I haven't found like a medical source of it yet. So we just refer people over to Amazon and to get it right now.
And they take the chances. And
Yeah.
viewer beware, the same bottle might have a different supplier every other quarter because you don't know who they're getting it from, even though the label hasn't changed. So that's why supplements that are not from a physician's office are something to worry about at times because they're not tested, whereas physicians have to sell products that are verified. So
Correct.
supplements on the internet, you might have one batch that works and the very same brand. The next time you get it, God knows who filled the order, because what's in the capsule is not necessarily what they talk about on the label because it says it on the label. They're not FDA regulated. It means nothing.
Supplements are not regulated at all. So they have no third party testing, but medical grade, which is what we sell in office, does. So until we find a medical grade, we don't, again,
Right.
I trust like a supplement, maybe store. And if they have brands that they trust, I trust they've done their research. But from our offices, we're selling medical grade supplements because they have to be third party tested. But this one, the jury's in. It works to increase your load and therefore orgasmic strength per men. Because obviously, we can't comment on it. We can't try it and comment, but you have to try it.
Because, well, some women will know about the load, but
Yeah,
they can
well,
comment
I
sometimes.
know. Well, they say that it increases their orgasmic strength. Like the more load they have, like the more volume, that the better orgasms. It's been almost across the board that men have said that. And it was actually one of our patients that brought it up. So that's what made us look into it and do the podcast on it. So it's interesting.
Well, I always learn from you, Dr. Durst.
I know, well, I learned it was from our patients, again, never a boring day in the office for sure. And always good topics. So, well, all right. Well, we will meet again. Next time we're going to do it in person for sure. Either in
Right.
your studio, which is about to be set up, and well, it's actually set up, about to go live, and or in our new one as well. And we're going to have a good time. We'll do a panel
So
and you get to pick the
let's do it.
topic. How's that?
I'll do it.
All right. Well, it was a pleasure having you, Dr. Ibrahim. And again, Built More Restorative in Asheville. And we'll have a link in the description. So comment, share with friends, and let us know if you want to deep dive into anything else, wellness or sexual wellness. Thank you.